Always low prices at Pahrump Valley Auto Plaza.
The playbook continues to be fluid. We must remain flexible to ensure a proper and robust COVID-19 vaccine response. We will continue to apply a data-driven approach to vaccine allocation and work with counties to ensure the playbook and the Advisory Committee on Immunization Practices recommendations are being followed for priority populations to be vaccinated. As more doses of the vaccine are received in Nevada and distributed to counties, some regions of the state may move into the next tier sooner than others, based on factors such as population size and vaccine demand within a tier group. As we work through the first tier of vaccination, Nevada's medical workforce are able to receive the vaccine, and our pharmacy partners are working to vaccinate staff and residents in Nevada's long-term care facilities. Our pharmacy partners are diligently testing their staff to ensure vaccinating pharmacists are COVID negative before entering the facilities to provide vaccinations. We have heard from many facilities across our state that this program is working well. In addition to long-term care facility staff and residents, the immunization program has worked with the State Aging and Disability Services Division to identify intensive supported living arrangements and supported living arrangement facilities for staff and residents to ensure these populations are also included in Tier 1. We are finalizing the updated vaccine playbook to include the most recent CDC recommendations, information for clinicians, more details on individual populations, and guidance related to the specific recommended vaccines. However, prior to the rollout of the completed updates, I wanted to provide you all with some decisions that have been made as of today. Nevada's tiered structure has been updated to include prioritization of people 75 and older in Tier 2, or what the CDC refers to as Phase 1B. These Nevadans will be vaccinated concurrently with the first group of Nevada's frontline essential workers. The list of Tier 2 frontline essential workers will not vary greatly from the current playbook, but further updates will be provided in the full rollout upon final review and conversations with stakeholders. Additionally, those 65 to 74 years of age and people with underlying health conditions will be vaccinated in Tier 3 alongside Nevada's second group of essential workers. Similar to Tier 2, the essential workers in Tier 3 will largely remain the same as those listed in the current playbook, with some adjustments that will be provided to the public in the full rollout. This playbook is a guide that we know will be adjusted as more information is learned and the vaccination rollout progresses across the United States. We continue to have a limited supply of vaccine and are working with organizations statewide to provide information on the tiers and prioritization of those unable to work from home and those most likely to come into contact with COVID-19 patients.